Hello, this is Dr. Mary Grady, and I am here to talk with you with this little PowerPoint from Pearson about sensory perception is the concept. And underneath this is actually the topic of peripheral neuropathy. So, here we go, peripheral neuropathy. There's a bunch of outcomes that they have in the book company PowerPoint that I will let you read, that they say that after doing all this, things that you should know are things you should learn. And so we're going to skip through that and get right to the heart of what we're going to talk about. And what is peripheral neuropathy? Well, basically what it is it's nerve disease or it's damage. And it results from trauma or a disease process. It is estimated that 20 million people in the United States have some form of peripheral neuropathy where there's damage to the peripheral nervous system. The peripheral nervous system, just to kind of go back to your anatomy, is the system that provides the communication network that transmits information between the central nervous system, which is your brain and your spinal cord, to all the other parts of the body. And they've also went on to find out that there's 100 types of this peripheral neuropathy that's been identified. And how they identify it is each one of them, these little clusters have its own symptoms and prognosis. So let's keep on going. Here was just reminding you again what I just said, that the peripheral nervous system is linked to the central nervous system. It provides the communication network for them. And then we get into those 100 types of neuropathies that I said that they have identified so far. We get into a couple of words called polynephropathies or mono. And where these go into play is, as they're identifying them, some forms of neuropathy involve damage to just one nerve. And if it's a single nerve, it's usually going to fall under mono, right here at the bottom, or one. And if it's poly, these are the ones that involve multiple nerves that are affected. And one of the most common ones that falls under the poly would be diabetes. Now, under mono, just maybe one nerve. An example of this is I broke my arm once, and it did damage to the ulnar nerve that runs down the arm. So I had a mono neuropathic problem, which resolved itself, but it was just that one nerve that was affected, not numerous ones. Okay, so how do we get these? How do you get a neuropathy? That's a good question. How you get a neuropathy is some of them are acquired, like mine, through trauma. I ended up with that to the ulnar nerve. Some is hereditary, things that run in families, different conditions. And some may be idiopathic, and that's my favorite word because that means nobody in the world knows exactly what is causing that problem. So when you get into the polynephro problems, those are the ones like our diabetics, and there's also some other complications where they can be chronic conditions and not just acute, like Guillain-Barré syndrome. Guillain-Barré syndrome is, kind of summing it up, it's when the body's immune system starts to attack parts of the peripheral nervous system. And when these parts get attacked, it impairs their ability to send and receive nerve signals. And because of this, the symptoms start to appear. And they start to progress rapidly. And they resolve slowly because it's slow because the damaged nerves have to heal if they're going to heal at all. So that's why that disease. Systemic diseases, diabetes, and prognosis ranges are going to depend on what is actually wrong with that person or how these nerves are going to heal. Some people with these conditions may have periods of relief followed by periods of relapse. Others may hit a plateau stage and then it starts to worsen over time, or some could actually resolve itself. But most neuropathies can fall into a category where we think of them as painful and potentially debilitating. So other conditions, alcoholism, cancer, carpal tunnel syndrome, these are all things that can affect the axons and have damage to your axons, which could interfere with the ability of the nerve transmission. So what makes us more prone to have this thing called a peripheral neuropathy? Well, if I'm diabetic, we know that this is probably one of the most common forms of it, and the nerve damage occurs in an ascending pattern with this condition. The first nerve fibers to malfunction are the ones that travel the furthest from the brain and the spinal cord. So that's why with your diabetics, you mainly see these problems starting in their feet, is where it begins. Alcohol abuse damages a lot of the neurons. Vitamin deficiencies can, especially vitamin B. Vitamin B does a lot for our neurosystem. Immune suppressed problems, autoimmune, kidney, liver, thyroid, age. There's a lot of factors that would make us prone to this. Age and the fact that as we start to get older, all of our body cells start to decrease. So how can we even prevent these things from even happening? Well, if we have one of the conditions that was on the previous slide, we should try to be controlling that condition with medication and with good healthy diets so that we can be the healthiest we can be. Just like the World Health Organization said, health is not merely the absence of disease or infirmity. So I need to keep myself as healthy as I can be, and that will prevent diseases. Or if I have neuropathies, it may prevent the disease from progressing quicker. I need to increase my B12 intake. B12 does something to almost every part of the body when you read about it. It is an amazing thing that's part of cellular metabolism across the board. And it actually helps with the neurons in the nerve system. And also avoiding triggers. They have found that people that do repetitive motions, like a lot of factory workers, even knitters, this causes a lot of damage to nerves if it's just over time. That's why carpal tunnel with that medial nerve is something that you see. Smoking is always bad. Causes cellular damage, not enough oxygen to cells and nerve cells, and that nature. Okay, so the clinical manifestations of this problem, these peripheral neuropathies, are going to vary depending on what nerve was affected and what nerve was damaged. It can range from numbness or tingling and a pricky sensation or muscle weakness. Areas of the body may become abnormally sensitive, leading to an exaggerated distortion of when touch happens, causing more pain than normal to stimuli. Or pain may occur in response to a stimuli that does not normally provoke pain. So your nervous system is all kind of goofy. You could even have severe symptoms like burning pain, muscle wasting, organ or gland dysfunction. So there's a lot of things that go into this, but pain is the big thing. They all present in a variety of forms depending on the nerves that are affected. And symptoms can last for days, weeks, years. Okay? But commonly you see the distal issues like in the feet and the lower body. Guillain-Barré, that's something that you keep seeing a lot listed as well, because that's one of the forms of things that are kind of peripheral neuropathy shows up with. So how do we test for these problems? Well, here's a few tests that you might see done. Electromyography is EMG, and that is where they actually put needles into you and they kind of give you a buzz or an electrical shock. And they do this to see whether your muscle is going to respond to this electrical shock, to try to see if it was nerve damage or if it's muscle damage, to rule the two out, which one it is. CBC, a complete blood count, because we want to rule out all the things that this could be. Sometimes we do more tests than we need to because we are trying to find an answer, and a lot of these tests are to just rule things out. like your metabolic panel and your thyroid and your urine screening and the nerve biopsy itself, and checking your B12 and your thiamine levels, because like we know before, B12 plays a part in problems. Now, how do we treat this? Well, the treatment is going to depend on what kind of nerve intervention or what's happening. If it's a tumor that's causing pressing on the nerves, of course you could have chemo or surgical removal of that tumor. Or if it's carpal tunnel syndrome, where the medial nerve is being compressed, they could go in and kind of release that area so it's not, is again like pressed. So if there's an obvious reason, I treat that obvious reason. But sometimes there's no specific treatment. And there's no catch-all drug that's going to affect or take care of all this, especially if it's caused by something like a chronic disease like diabetes. So they may use pain relievers to try to relieve the pain. Sometimes anticonvulsants work to relieve a lot of these problems because it works on the nervous system and kind of relieves some of these sensations and problems people are having, the signs and symptoms. Antidepressants have actually worked as well, and lidocaine patches. Non-pharmacological is we just got to manage whatever the underlying cause. So if I'm diabetic and that's what's causing this problem, then I need to solve that problem. Physical and occupational therapy might be needed too, just so that people are still exercising the area, even though they have sensation and they're in pain. We don't want people to not be using things. If you don't use it, you lose it. And by using your extremities and your body, it keeps from other complications occurring. And then changes in daily life. You know, basically, it's the same old, eat right, exercise, the whole shebang. Also, some things that they have found that have been useful for some people with neuropathies is acupressure or puncture. These biofeedback TENS type of units that give electrical shocks to areas and makes the nerves respond have been helpful, and massage. The nursing process requires us to have a lot of collaboration with the patient and with other health providers. Gathering good nursing history and doing a good physical assessment is very, very important. Some of the diagnoses for peripheral neuropathy that you might see, I think the biggest one would be risk for injury because I can't feel anything. And I've told this story in class before about the diabetic that stepped on a Lego and didn't even know they had stepped on it, and it stayed there for a while and caused quite a wound. You could have ineffective peripheral tissue perfusion because of the vascular changes to that part of the body. Pain and anxiety. Pain and not feeling good always leads to anxiety. So our goal is to keep the patient free from injury, try to help them with pain management, and try to help them verbalize feelings, because if I have a chronic condition that I'm living with, like peripheral neuropathy, and I've always got this pain that I'm dealing with, I might start to go through those stages of grief where I start to grieve the loss of my feeling and my sensation and my not feeling bad all the time. Preventing injury is a lot of things. Going over people, like checking their feet with a mirror underneath it every night. Having their house set up where a lot of these things that could provoke injury are not. Not going barefoot in the summertime. Just going over things with people. Thinking about their lifestyle and things that could be altered to keep them safe. Teaching points listed here as well. And ways to provide comfort. Listening very closely to their description of their pain and their triggers, and figuring out if there is something triggering the pain that could be avoided. And the things we want, outcomes we want, is the patient to feel better about things and to remain safe. And that concurs or ends, whatever word I want to use here, the end of peripheral neuropathy. I hope that this was helpful for you, and there'll be more of these coming along. Bye-bye.